Across the world, millions of people are struggling to conceive. They are battling with infertility, but also even those who manage to succeed and have a pregnancy, most of them end up in miscarriages. To make matters worse, recurrent miscarriages. And this means someone gets their first pregnancy, it comes out, the second one comes out, maybe even the third one, and so on and so forth. However, there are actually several causes of these miscarriages, most of which are avoidable and others are manageable. But the population most times is ignorant, and I'm sorry for using this word, but does not know or is not aware of the possible causes and how they can be managed. Today I want to talk about mid-trimester miscarriages. There's what we call first trimester miscarriages. Those are miscarriages or abortions that are not induced, which happen before 12 weeks of gestation. However, we have what we call mid-trimester or second trimester miscarriages, and these happen from week 13 onwards. The second trimester usually goes up to week 28. However, most miscarriages in the second trimester happen between week 13 to week 20. And there are several causes, most of which are anatomical in nature. That means something to do with the structure of your pelvic organs. Today I want to focus about something that is very common but mostly ignored, especially in low resourceful settings, at OPDs when a lady comes in, is having a miscarriage, they do evacuation, she goes back home, and the process continues. Today I want to talk about something we call cervical incompetency. Cervical incompetence, this refers to a situation where your cervix has lost its retentive power or potential. It has been compromised. This means your cervix is unable to actually maintain a pregnancy, that you will conceive, the pregnancy will grow up to a certain point, and then because of this pressure that is being put on the cervix, it opens up, it dilates, it opens, and then the pregnancy comes out. This is a very common condition, and most times it is ignored. However, some of the causes could be genetic abnormalities of the cervix, but this is not a very common cause. So most common causes are actually acquired of cervical incompetency, and they include things like abortion, which is induced using methods like D&C, D&E, where you have to first direct the cervix manually. Now, don't misquote me. I'm not saying that all abortions will lead to cervical incompetence. However, several procedures that involve dilatation would actually lead to cervical incompetence in the long run, or it actually poses a risk. These include procedures beyond abortion, which might need dilatation of the cervix manually. Other acquired causes include vaginal delivery, which was a bit traumatic. For example, you got a cervical tear. Cervical tear, if not well repaired, puts you at a risk of developing cervical incompetency. Other factors might include things like multiple gestation, where you're carrying 2 or more fetuses. The pressure put on the cervix can predispose you to the incompetence. And then previous or prior preterm delivery, it can actually predispose you to future incompetence. And then any other operations that could be done on the cervix beyond just the tear. So if you're someone who has experienced this, you've been pregnant up the second trimester, and then out of nowhere you get a painless dilatation of the cervix followed by expulsion of the products of conception, or what you call the fetus, you could actually be suffering from cervical incompetence. It's better you visit a doctor. This can be done before you're pregnant or when you're pregnant. An examination can be done, a checkup can be done to ascertain and manage accordingly. Some of the checkups that can be done in the interconception period when you're not pregnant might include passing of what we call a Heger dilator, or those methods we use to dilate your cervix, of a given size, maybe like 6 or 8. And if it passes through your cervix without any resistance or pain, it simply means your cervix is incompetent or it has opened up. Also, we could do what we call a cervicography. This is a procedure. It's not commonly done, especially in low resource settings, but it can help us identify where the cervix is incompetent. During pregnancy, we shall do also a number of investigations and checkups. We could do basically a clinic exam using a spatula, where we can be able to examine the cervix, but also we can do an ultrasound scan. This, in case there's incompetence, will reveal a shortened cervix, which is probably less than 25 millimeters. So in case this happens, it means you're having the incompetence, and anytime this cervix can open up and you lose your pregnancy. So the doctor will actually take an initiative to give you appropriate management, and this will include one, doing a procedure that we call a cervical sacrilege. Now in cervical sacrilege, we are going to use our suture, which is non-absorbable, maybe like nylon. We tie it around your cervix. Once we do this, we shall be making it unable to open up. So this usually helps you to keep the cervix closed, and you're able to carry your pregnancy until when you reach term. So at term, what we shall do is we shall go and release this stitch. You shall release it, remove it, and this will allow your cervix now to open up, and you can have your normal vaginal delivery. This procedure is usually done at around 14 weeks of gestation. However, in case of an emergency, we can do it around the 10th week. Okay? And after the procedure has been done, of course, we shall advise you on what you need to do. Some of the things include avoiding intercourse, avoiding long journeys, doing your normal antenatal, but also reporting to the health worker or the hospital as soon as you notice any bit of abnormal vaginal bleeding, stomach pain, or abdominal pain. You might need to report for a checkup. And we shall do periodic ultrasound scans to monitor the fetus and progress of your pregnancy. Of course, there are contraindications where this procedure might not be done. Maybe you're having a very bad infections, maybe your membranes have already ruptured, maybe the fetus is already dead. You might not do this procedure. Where your uterus is severely irritable, and where your cervix, the diameter is beyond 4 centimeters, you might not be able to do this procedure for you. Of course, there's some complications with this procedure, but the doctor will definitely take you through and will be very careful. And in case of any complication, he will intervene immediately. So I might not take you through those complications here. You can look them up. But yes, the doctors are usually trained to handle them in case they happen, and they intervene accordingly. Of course, there are alternatives to the cervical sacrilege, where surgical intervention is not preferred. However, their effectiveness is also a bit less, but we might do things that are actually limiting the pressure in your cervix. So that means we're going to recommend a bed rest for a long time. We also need maybe give you some bit of progesterone supplementation, and most times this could be an injection, among others. Yes, so the bottom line of this is, in case you're someone who has experienced 2 or more miscarriages that happen beyond 12 weeks, you need to go and have a checkup done. You could be having cervical incompetence, and this is something that we can manage. I've seen very many people carry their pregnancies to term and have healthy, normal, and bouncing baby boys and girls, and they are living a good and happy life. Yes, so we shall continue with this discussion in our next video, and I wish you all the best on this journey as you're trying to get to parenthood. Thank you. Please remember to subscribe, like this video, comment, and also share with your colleagues so that we learn together. Dr. Rogers here. I wish you all the best.